There are many reasons you may be taking this class: job, license renewal, certification. Before you begin, we'd like you to hear from some people whose lives were changed by the skills that you're learning today. At the Golden Anniversary Survivor Celebration, 50 cardiac arrest survivors gathered to honor the heroism of the people who provided the CPR that helped save their lives. Brian is an NSC pediatric instructor and the loving father of 3. The family had gathered at their grandparents' when 2-year-old Kinley slipped out of the house and ended up in the swimming pool.
I hear my father yell no, and I knew immediately something bad had happened. So I started CPR.
After the paramedics arrived, Kinley was taken to the hospital and put on 100% life support, but eventually she made a complete recovery.
Yeah, you guys gave me the tools and the skill sets to save a life.
Jim was at work on the ramp at Southwest Airlines when he went into cardiac arrest. Fortunately, his co-workers were trained in NSC first aid and CPR.
I stopped and just went face first into the baggage cart and then down onto the cement. He said, you were blue and purple, and he said, I knew you were dead. He said, there wasn't any question that you were dead. And right after he yelled for help, he started CPR.
Thanks to early intervention with CPR, Jim not only survived, but made a complete recovery.
I don't make it real well. I mean, there'll be times where I'll just be sitting there and I'll say, I'm so glad I have you.
The doctor was very adamant about the fact that he said, Jim, you got to go back and thank him, because he said that's the only reason they're alive is because they did CPR on you. And they did it correctly.
I don't think that I've ever realized how important it was until I actually had to see it performed on my daughter.
I never thought that using my hands would save my daughter's life. I caught her with these hands when she came out, and then I pumped air through her body with compressions 2.5 years later.
Every year, over 300,000 people in the U.S. alone suffer from sudden cardiac arrest. Prompt CPR increases the chance of survival. And when you learn CPR, you're making yourself a potential lifeline and offering strangers, co-workers, and family members a hope of life.
I guess thanks is just not enough. Never did find the right words really to tell them that.
It all happened so fast. I barely had time to think. That's how people describe dealing with real-life emergency situations. Whether you're at work, at home, or on the road, an emergency situation can happen in a heartbeat, and that's when knowing first aid makes all the difference.
Hey Charlie, how's it going?
Allison, hi. You know, I'd like to get my hands on the guy who taped up this box.
Oh, a good day then, huh?
Welcome to my world. Could you hand me that box cutter?
Oh, sure. Here you go.
Every day we come across situations that are just accidents waiting to happen. First aid training gives you the know-how to act quickly and effectively. The overall goals of first aid are simple. Keep the person alive, prevent their condition from worsening, give first aid until help arrives, and ensure that the person receives any needed medical care. There are 6 basic steps to follow in any emergency. Let's see how this plays out.
Well, that's it for me. Have fun.
Ugh.
The first step is to recognize the emergency.
Are you okay? Hey, what happened?
Just nicked myself, no biggie.
Ooh, let me see that.
Next, check the scene for safety. Make sure there is no danger to you or anyone else, and never enter an unsafe scene.
Oh, wow.
It's not that bad. There's just a lot of blood.
Check the person. Always look for life-threatening conditions before starting to give care.
So are you okay? I mean, other than the cut.
It really hurts.
Oh, Kathy, we need some help in here. Could you please go get the first aid kit? Thanks. All right, Charlie, you're doing fine.
No, I'm not.
Now, just push your hand against the wound to help it stop bleeding. Oh, thanks. And could you also go get the building engineer? We need him to clean up this blood and get rid of this box cutter.
How about an ambulance?
No, I don't think we need to call 911, but I will take you to the clinic. We need to get that bleeding under control. Charlie, I'm trained in first aid. Is it okay if I help you get that bleeding under control?
Yeah, sure, whatever. I hate blood, man.
Yeah, me too.
The next step is to provide care. Obtain consent to provide first aid. If the person is unresponsive and cannot give consent, it's okay to provide care. Provide only the type of aid you have been trained in and don't move the person unnecessarily.
It's still bleeding a little. I'm going to bandage it.
Continue to give care. And finally, have the person seek medical attention when needed.
All right, that looks pretty good. Let me just get my coat and purse and I'll drive you to the clinic.
Allison, maybe I don't need to go, yeah?
No, let's just play it safe and let a medical professional take a look at it, huh?
When you're providing first aid, you're thinking of others. But at the same time, it's essential to protect yourself from disease transmission because contact with blood and bloody saliva or vomit may expose you to viruses such as HIV and diseases such as hepatitis. Due to the possible risk of disease transmission, it's always safest to avoid contact with all body fluids in a first aid situation. Here are the key precautions to take in order to prevent exposure to body fluids.
Use medical exam gloves or cover your hands with plastic bags or plastic wrap to make a barrier if you don't have gloves available. When possible, always wash your hands with soap and water before and after giving first aid. Do not touch your mouth, nose, or eyes when giving first aid, and do not eat, drink, or smoke. If you may have been exposed to any body fluid, wash immediately with soap and water, and if you are at work, call your healthcare provider or report the situation to your supervisor. When giving first aid, the gloves that you are using can become contaminated with blood or other bodily fluids. Here's the safest way to remove contaminated gloves. Hold your hands away from your body with fingers pointing downward. Grasp one glove at the wrist and remove. Now, keep the first glove in your hand while you insert 2 fingers under the cuff of the second glove. Turn the glove inside out as you pull it off. Then, dispose of the glove safely and be sure to wash your hands thoroughly with soap and water when you're all done.
Checking the person's condition is an essential in emergency situations. There are 3 key steps.
First, check for responsiveness and normal breathing. Tap the person's shoulder and shout, "Are you okay?"
Are you okay? Are you okay?
An unresponsive person is always considered a 911 emergency. At the same time, check whether the person is breathing normally. Occasional gasps are not normal breathing. Step 2. If the person is not breathing or not breathing normally, call or send someone to call 911 and get an automated external defibrillator if there's one nearby. Return to the person, turn on the AED, and follow the prompts. Step 3. With a breathing person, check for severe bleeding that might be life-threatening if not taken care of right away. Ignore minor bleeding until you're sure there are no immediate threats to life. Now it's your turn to practice. When normal breathing has stopped, CPR can give someone their life back. The good thing is that it's simple to learn. In this program, you will watch as CPR skills are demonstrated and then have a chance to practice along with the video. Your instructor is a vital link between the mannequin in front of you and the video training. While you're watching, the CPR professional may give you individualized coaching to help you achieve the best results during practice. Skills are divided into 2 main sections. The first teaches the basics, pumping and breathing. The second section covers when to do CPR. This will help you understand when it's necessary to help someone and what important steps to take prior to starting CPR. Please note that although personal barrier devices like gloves and face masks are always recommended, you won't see them here. Not only is it easier for you to practice without them, but it's also fine to give CPR in an emergency without them. The risk of infection is very, very low. Let's get started. If you are not already seated next to a mannequin, sit down and get ready to learn skills that could save a life. Sit comfortably while skills are demonstrated. You'll be prompted to get ready for the practice sections. The key reason for CPR is to circulate oxygen to the brain. Pumping the chest acts in place of a beating heart. It's essential to get the speed and force of the pumping right. Watch as this basic skill is demonstrated. You'll practice it in a minute. To pump, our rescuer kneels next to the mannequin and places the heel of his hand in the center of the chest. He puts the other hand on top and interlocks his fingers, then moves his shoulders directly over the chest with arms straight. The rate of pumping is faster than 1 per second. It's equivalent to at least 100 compressions per minute. Let's listen to that rhythm. A full cycle of pumping is down and up 30 times. It helps to count it out loud. Let's see a cycle.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Breathing is included for effective CPR. A full cycle of CPR is 30 chest compressions followed by 2 rescue breaths. The cycle repeats, 30 pumps, 2 breaths, until the person wakes up, an AED is available and ready to be used, or additional help arrives. Relax and watch as our rescuer demonstrates rescue breathing. You'll practice it afterwards. First, he needs to open the airway. Tilt the head back and lift the chin. Then he pinches the nose and places his mouth around the person's mouth, creating a seal. He gives 1 breath, lasting about a second. He watches from the corner of his eye to confirm that the chest rises as air goes in. He releases the seal on the mouth and lets the air flow out, then quickly seals it again and gives another breath. This is done faster than you might imagine. Watch the demonstration again in real time. It's important to give breaths quickly and get back to chest compression away and remove any obstruction you see. Now is a good time to review barrier devices. Although there have been no known transmissions of disease from mouth-to-mouth contact, barrier devices should be used if possible. But don't delay CPR in order to get one. The 2 most common types of barrier devices are pocket masks and face shields. A pocket mask is positioned on the person's face over both the mouth and nose. Make sure a face shield is well sealed to the face. You will still need to pinch the nose and get a firm seal around the mouth. Now let's practice it again. Tilt head and lift chin. Pinch nose. Breathe 1. Breathe 2. Relax. Remember to watch for the chest rise from the corner of your eye. Let's do it one more time. Ready? Begin. Breathe. Breathe. Okay, sit back and relax. When we put breathing together with pumping, you'll give 2 breaths after every 30 chest compressions. You've got the basics of CPR. Now let's put them together. Pumping the chest and rescue breathing. Kneel next to your mannequin and get ready to practice. Position your hand on the center of the chest. Lock fingers together. Move shoulders over the chest with your arms straight. Ready? Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
Keep your shoulders in position over the chest and push down hard with your arms straight.
22, 23, 24, 25, 26, 27, 28, 29, 30.
Tilt head, lift chin, pinch nose. Make a seal over the person's mouth with yours and breathe 1, breathe 2. Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Press
11,
down smoothly.
12, 13,
Don't jab.
14, 15,
Let the chest
16,
come all the way
17,
back up.
18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Tilt, lift, pinch. Breathe 1, breathe 2. Sit back for a moment. Now let's do it again. Remember, it's essential to move quickly between pumping and breathing. Position hands on the breastbone. Get ready to count out loud. Now, pump.
1, 2, 3, 4. 5,
Hard and fast.
6,
Push down
7,
at least 2
8,
inches.
9, 10, 11, 12, 13, 14, 15, 16.
Let the
17,
chest recoil
18,
between
19,
pumps, but
20,
keep your hands
21,
in contact
22,
with the
23,
chest.
24, 25, 26, 27, 28, 29, 30.
Give breaths. Ready? Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22.
Stay strong.
23,
Keep
24,
pace with the
25,
video.
26, 27, 28, 29, 30.
Give breaths. Okay, relax. On a real person, you would keep doing CPR until the person wakes up, an AED arrives and is ready to use, or emergency personnel take over. Now that you know the essentials of CPR, let's talk about when to do it. Watch while our rescuer demonstrates the steps to take before pumping and breathing. If he finds a person who looks unconscious, he must decide if CPR is needed. First, he checks for responsiveness. He taps the person and shouts,
Hey, are you okay?
At the same time, he is also noting whether the person is breathing. A person with abnormal or absent breathing needs CPR. If there's no response, he moves to the next step. Call for help. This is essential. The faster help arrives, the better the chance of survival. If possible, our rescuer will direct someone else on the scene to call 911 and get an AED unit. He picks a specific person and gives explicit instructions.
Sue, call 911 and get an AED.
But if no one else is available, the call still needs to be made first. For the purposes of this video, we will only practice directing someone else to make the call. If an AED is available and ready to go, he will use it right away. If not, he starts CPR. Chest compressions are first. He opens the person's shirt and positions hands to pump.
1, 2, 3, 4.
He continues CPR until the person wakes up, and there are a couple of special situations you should know about. Sit back and watch as we go through them. If you find an unconscious person sitting in a chair or lying in a bed, you must move them before you can begin CPR. CPR cannot be done correctly unless the person is lying on a hard, flat surface, such as the floor or the ground.
Hey, are you okay?
Move the person as best you can. Protect the head so it doesn't hit the floor. Position the person on his back. Remember, CPR will not work unless the person is on a hard, flat surface. A person may vomit while you are giving them CPR. If this happens, stop and turn the person's head to the side. Use your fingers to sweep the vomit out of the mouth and throat, then return to doing CPR. When 2 or more rescuers are available, switch chest compressors after about 2 minutes or 5 cycles of 30 compressions and 2 breaths. Alternating rescuers prevents a decrease in the quality of compressions caused by rescuer fatigue. Let's watch as 2 rescuers demonstrate how to navigate a switchover. Rescuer 1 has been pumping and breathing for 5 cycles. Rescuer 2 is going to take over the job. Rescuer 2 gets into position on the other side of the person. As Rescuer 1 gives breaths, Rescuer 2 gets arms into position to give chest compressions. It's important, though, to make the switch in 5 seconds or less.
10, 11, 12, 13.
An automated external defibrillator, or AED, is used when a person's heart stops beating or is beating ineffectively during cardiac arrest. AEDs can be used on adults, children, and infants. The quicker one is used, the better, because the chances of survival decrease by 10% for each minute a shock from an AED is delayed. These powerful cardiac resuscitation tools are becoming common anywhere people gather. They can be found in places like airports, malls, schools, and churches. But it's important to remember that if an AED isn't immediately available, you should start CPR right away. Watch the following demonstration as 2 rescuers use an AED. Rescuers arrive on the scene and start by assessing the person.
Hey, are you okay?
I'm going to go call 911 and get the AED.
Meanwhile, Rescuer 1 begins CPR.
1, 2, 3.
AED units come in many sizes and shapes. Some have start and shock buttons, some have no buttons at all, but they will all operate in the same way. When you use one, follow the instructions given by that unit.
7, 8, 9.
Rescuer 2 placed the unit by the person's shoulder. Now she turns it on and follows the prompts.
18, 19, 20, 21, 22, 23.
Look carefully at the pictures on the white adhesive pads.
The AED pads need to make contact with the skin, so Rescuer 2 must prepare the chest. If it's damp, she will dry it. If the person has thick chest hair, she'll shave some of it off. If no razor is available and there's an extra set of pads, she'll use them to remove hair from the chest. She'll also move any metal that could come in contact with the pads.
Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
24, 25,
When the first pad is in place,
29,
look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner.
4, 5,
Place pad exactly as shown in the picture.
11, 12, 13,
Press firmly to patient's bare skin.
18, 19, 20, 21, 22, 23, 24.
No one should touch the patient. Analyzing.
Don't touch the person while the AED is analyzing the heart. You must be certain that no one is touching the person.
Shock advised. Stay clear of patient.
Everybody clear.
Press the flashing orange button now. Shock delivered.
Be prepared. When a shock is delivered to a real person, muscles will jerk. After the shock, Rescuer 1 immediately restarts CPR. They will do 5 cycles of CPR. A cycle is 30 compressions plus 2 breaths. They will continue to follow the AED prompts. There are some differences when using an AED on an infant or a child under age 8. Smaller pads are used, but if none are available, use adult pads. Never use pediatric pads on an adult. Let's practice AED use with 2 rescuers. Decide who will be Rescuer 1 and who will be Rescuer 2. Rescuer 1, assess the person. Rescuer 2, call 911 and go for an AED. Rescuer 1, start CPR. Expose the chest, position hands, and start pumping. Keep pumping until the AED pads are ready to be placed on the person. Rescuer 2, place the AED next to the person's shoulder. Turn it on and listen for the prompts.
Look carefully at the pictures on the white adhesive pads.
Rescuer 1, continue CPR compressions until the chest is prepared and the first AED pad is ready to be positioned.
Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
16, 17, 18, 19, 20, 21, 22, 23, 24.
No one should touch the patient. Analyzing.
Don't touch the person while the AED is analyzing the heart. You must be certain that no one is touching the person.
Shock advised. Stay clear of patient.
Everybody clear.
Press the flashing orange button now. Shock delivered.
After the shock, immediately give CPR for 5 cycles.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28.
You can stop pumping and sit back. Although AEDs are often located in places where people gather, it's important to know the steps to take if you are the only rescuer when you need to use an AED. Let's take a look at how to use an AED with a single rescuer. First, our rescuer assesses the person. When he realizes that they are unresponsive and not breathing normally, he calls 911 first.
916 North Chester. My friend is unresponsive. Please send help.
Then, if he knows an AED is nearby, he goes to get it. Next, he places the AED next to the person's shoulder, turns it on, and follows the prompts.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
If the chest is damp, he will dry it. Also, if the person has thick chest hair, he'll shave it or use a second set of pads to remove hair from the chest.
When patient's chest is bare, remove protective cover and take out white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
He is careful not to touch the person while the AED is analyzing the heart.
No one should touch the patient. Analyzing.
He must be certain that no one is touching the person.
Shock advised.
Everyone clear?
Stay clear of patient.
Some AEDs deliver the shock automatically. Some require a button to be pushed.
Press the flashing orange button now. Shock delivered.
After the shock, he immediately gives CPR for 5 cycles. Each cycle is 30 chest compressions. When normal breathing and heart function have stopped, CPR can give a life back. This section covers CPR skills for children ages 1 through the onset of puberty. At the end of the segment, there will be a demonstration of CPR for an infant. You will watch as skills are demonstrated and then have a chance to practice along with the video. During those practices, your instructor may give you individualized coaching to help you achieve the best results during practice. Please note that although barrier devices like gloves and face masks are always recommended, you won't see them here. Not only is it easier for you to practice without them, but it's also fine to give CPR in an emergency without them, as the risk of infection is very, very low. Let's get started. If you are not already seated next to a mannequin, sit down and get ready to learn skills that could save a life. The key reason for CPR is to circulate oxygen to the brain. It is essential to get the speed and force of the pumping right. Watch as this basic skill is demonstrated. You will practice it in a minute. To pump, our rescuer kneels next to the mannequin and places the heel of her hand in the center of the chest. Depending on the size of the child and the size of the rescuer, she will use one hand or 2 interlocked together to get the proper chest compression depth while pumping. She moves her shoulders directly over the chest with her arms straight. The rate of pumping is faster than 1 per second. It's equivalent to at least 100 compressions per minute. Let's listen to that rhythm. A child's chest should compress about 1/3 the depth of the chest, or about 2 inches. A full cycle of pumping is down and up 30 times. It helps to count it out loud. Let's see a cycle.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Now, get ready to practice pumping along with the video. Kneel next to the mannequin with your knees against the side of the chest. To pump, you'll use the heel of your hand. Place it on the center of the chest. Be careful not to press on the tip of the breastbone. Now, push down firmly with the heel of your hand. Remember, a child's chest should be compressed 1/3 the depth of the chest, which is about 2 inches. Let the chest come all the way back up by removing your weight from the chest. Your hand should remain in contact with the breastbone at all times. Pumping should move down and up smoothly. Don't jab. Get ready to do a 30 pump cycle in time with the on-screen rescuer. You should count out loud too. Ready? Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Don't be afraid to push hard and fast.
16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Sit back. Remember, pumping is fast and forceful, and when your shoulders are over the heel of your hand, you won't tire as quickly. You will get additional opportunities to practice pumping in this program. Rescue breathing is included for effective CPR. Relax and watch as our rescuer demonstrates rescue breathing. You'll practice it afterwards. First, she needs to open the airway. Then she pinches the nose and places her mouth around the child's mouth, creating a seal. She gives one breath lasting about a second. She watches from the corner of her eye to confirm that the chest rises as air goes in. She releases the seal on the mouth and lets the air flow out, then quickly seals it again and gives another breath. This is done faster than you might imagine. Watch the demonstration again in real time. Now, get ready to practice breathing. Kneel next to the mannequin's head. Put the palm of one hand on the mannequin's forehead and tilt the head back. With the fingers of the other hand, lift the chin. This opens the throat to allow air to get into the lungs. Use the hand on top of the head to pinch the nose. Open your mouth wide and cover the mannequin's mouth completely with yours, pressing firmly to make a tight seal. Take a normal breath and blow air into the mouth. It's a quick breath of air with sufficient volume to make the chest rise. Remove your mouth from the mannequin. Take another breath yourself. Now breathe into the mouth again. Take your hands off the mannequin and sit back. This time, let's do it at the recommended pace for CPR. Tilt the head and lift the chin. Pinch the nose. Give breath. Give breath. Remove your hands from the mannequin and sit back. If you hear a hissing sound when you blow, air is leaking out from the nose or the mouth. Be certain the nose is pinched firmly, the chin is lifted, and there is a good seal around the mouth. If you don't see the chest rise during a breath, re-tilt the head and try again. If it still isn't rising, you'll need to check the airway and remove any object you see. You've got the basics of CPR. Now let's put them together, pumping the chest and rescue breathing. Kneel next to your mannequin and get ready to practice. Position your hand on the center of the chest. Move shoulders over the chest with your arms straight. Ready? Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
Keep your shoulders in position over the chest and push down hard with your arms straight.
22, 23, 24, 25, 26, 27, 28, 29, 30.
Tilt head, lift chin, pinch nose. Make a seal over the child's mouth with yours and breathe 1, breathe 2. Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Press down smoothly. Don't jab. Let the chest come all the way back up.
19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Tilt, lift, pinch. Breathe 1, breathe 2. Okay, sit back and relax. On a real child, you would keep doing CPR until the person wakes up, an AED arrives and is ready to use, or emergency personnel take over. Now that you know the essentials of CPR, let's talk about when to do it. Watch while our rescuer demonstrates the steps to take before pumping and breathing. If she finds a child who looks unconscious, she must decide if CPR is needed. First, she checks for responsiveness. She taps and shouts,
"Hey, are you okay?"
At the same time, she is also noting whether the child is breathing or only gasping. A child with abnormal or absent breathing needs CPR. If there's no response and no breathing, she moves to the next step. Call for help. This is essential. If possible, our rescuer will direct someone else on the scene to call 911 and get an AED unit. She picks a specific person and gives explicit instructions.
Drew, call 911 and bring the AED.
If no one is available to make the call and the victim is a child, do 5 cycles of CPR before pausing to make the call yourself. For the purposes of this video, we will only practice directing someone else to make the call. If an AED is available and ready to go, she will use it right away. If not, she starts CPR. Chest compressions are first. She opens the child's shirt and positions her hand to pump.
1, 2, 3, 4, 5.
She continues CPR until the person wakes up, an AED is available and ready to use, or help arrives to take over. For now, let's practice the steps for when to do CPR. Put a shirt or jacket on the mannequin so you can practice exposing the chest. If you don't have one, just pretend to remove clothing from the chest. Sit next to your mannequin. If you find a child who looks unconscious, you need to find out if they are unresponsive. They could just be asleep. Tap the child on the shoulder and shout, "Are you okay?"
Hey, are you okay?
At the same time, note if they are breathing or only gasping. If the child does not respond and is not breathing, direct someone to call 911 or the local emergency number to get help on the way.
Drew, call 911 and bring the AED.
Quickly get back to the child. If an AED is available and ready to use, then use it. If it's not, start CPR. Expose the chest so you can see where to place your hand. Make sure your knees are against the side of the chest. Place the heel of your hand on the center of the chest in contact with the breastbone. Before we add pumping, let's practice this again in real time. Sit back. Now start the assessment. Tap and shout.
Hey, are you okay?
Have someone call 911 and get an AED.
Drew, call 911 and bring the AED.
Open the shirt and position your hand to pump. Okay, in the next section, we'll put this together with pumping and breathing. You're ready. You've practiced all the skills. Now we'll put them together. Let's do CPR. Sit next to your mannequin. When you see a child who looks unconscious, assess the child.
Hey, are you okay?
Direct someone to call 911.
Drew, call 911 and bring the AED.
Expose the chest. With your knees against the chest, place your hand in position. Get ready. Pump.
1, 2, 3, 4, 5, 6, 7, 8.
Each pump should depress the chest about 2 inches. Then let it rise all the way back up, but keep your hand in contact with the chest.
21, 22, 23,
Get ready to breathe.
24,
Each breath lasts 1 second.
28, 29, 30.
Give breaths. 1, 2. Arms straight. Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Give breaths. 1, 2. Ready? Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Breathe 1. Breathe 2. Position and pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Keep up the pace.
14, 15,
Count out loud.
16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Breathe. Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
And breathe. Sit back. That was 5 cycles of pumping and breathing. Good work. Alternating rescuers prevents a decrease in the quality of compressions caused by rescuer fatigue. After 5 cycles, you may switch who is doing CPR. When doing CPR on an infant under the age of 1, there are a couple of key differences in how the skills are performed. Watch as our rescuer demonstrates CPR for infants. When she assesses the infant, instead of tapping and shouting, she stimulates the infant's foot to check for response. The response can be any vocal sound like crying or cooing or a body movement. At the same time, she assesses whether the infant is breathing. Once she determines that CPR is necessary, she exposes the chest and instead of using the heel of her hand, she positions 2 fingers just below the nipple line. She pumps at the same rate as for children, but the depth is different. The compression is 1/3 the depth of the chest, or about 1.5 inches.
16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After a cycle of compressions, she tilts the head back and covers the mouth and nose completely with her own mouth and gives 2 breaths, each lasting about 1 second. The volume of air is enough to make the chest rise. If you are alone with an infant or child who needs CPR, complete 5 cycles of pumping and breathing before calling for help.
27, 28, 29, 30.